Meniere's disease is a condition where there is buildup of fluid inside your inner ears compartment, which is called as labyrinth. Now Hello friends, welcome to the series on vestibular disorder. And in today's video, what I am going to cover is the most common and the most difficult condition to treat in vestibular disorder, and that is Meniere's disease. So we are going to go little deep in the science and try to understand what exactly happens in this Meniere's disease. How do you come to know whether you have Meniere's disease and vertigo symptoms coming due to that? And I'm also going to shed some light on what can be done in order to manage this Meniere's disease. Let's get started. Meniere's disease is a condition where there is buildup of fluid inside your inner ears compartment, which is called as labyrinth. Now your inner ear has a very important organ or system which is called as vestibular system. This system is responsible for all the balance that you experience. When you turn your neck side to side, or when you look down and up, or even you turn around, you still don't lose balance. You maintain your stability. But think about it. What happens when you rotate round and round, for example, in a merry-go-round? You will feel dizzy sometime, right? You will feel that things around you are moving. Why this happens? This happens due to this particular organ that's present inside your ear, which is called as your vestibular organ. This organ, it's like a structure which has got some fluid inside it, some crystals inside it, and these movements of fluid and crystal maintains a balance and sense of balance inside the body. This organ is directly connected to your brain. All the information that this organ captures goes to your brain. There it is being processed and then the brain sends back the signal. Many a times due to various disorders, there is some deflection in the functioning of these structures which lead to altered symptoms of balance in the form of dizziness, vertigo, tinnitus, etc. etc. And one such condition where commonly this balance gets affected is this condition which I am speaking about right now, that is Meniere's disease. Now as I mentioned that you have one organ or else a structure inside this organ which is called as labyrinth. This organ has got fluid inside it. This fluid moves as you move your head. Now whenever there is an excess fluid that gets built up in this area due to various inflammation and other conditions, it will lead to sense of altered balance. That's what exactly happens in this Meniere's disease. This balance gets not only affected, but it also impacts your other functions of balance system. There will be a constant altered sense due to miswiring that will lead to the next symptom, which will be tinnitus. If you don't know what is tinnitus, how it happens, what exactly has happened, I have already made one video in which I have tried to explain you about tinnitus in little bit more detail. Make sure to watch that out and then you can come here. Apart from tinnitus, there will be other symptoms like vertigo, which means dizziness. In this vertigo, you will feel either the surrounding is moving or else you are moving and the surrounding is stable. This majorly will happen whenever you will turn immediately or suddenly, or else you will move your eyes suddenly. This will happen because there is a constant pressure that is falling on this organ. A sudden jerky movement will take some time for the fluid to settle down again. Now, let's discuss about what is the cause of Meniere's disease. All the vestibular disorders are little mysterious in nature. There are not very short definite causes for that. Many a times Meniere's disease can happen to any individual without any predisposing signs and symptoms or any other condition. People who have got high blood pressure, people who have got diabetes mellitus are at higher risk of developing Meniere's disease. This happened majorly in them because of constriction in the blood vessels. Many a times, Meniere's disease could be a consequence of a viral infection inside your ear. Even people who have got Ramsay-Hunt syndrome, which is a variant of facial paralysis or Bell's palsy, are likely to develop Meniere's disease in future. because of the constant inflammation and irritation that's happening inside the ear. People who are allergic to various environmental irritants are also likely to develop Meniere's disease. Many autoimmune disorders like systemic lupus erythematosus or else multiple sclerosis are some problems which could lead to Meniere's disease. Meniere disease is also common as it is genetic in nature, which means it might run in families. So this was about Meniere's disease prevalence and who get it. Now let's talk about what will be the symptoms that you will experience very specifically in Meniere's disease that will help you to identify whether you have Meniere's disease or not. The number one distinctive factor of Meniere's disease will be you would have got at least 2 episodes of vertigo which will be lasting more than 20 minutes. In that case, you are at a higher chance of developing or having Meniere's disease. You will have a constant sense of fullness in your ear. You will feel that there is some fluid, something that's present inside the ear and your ear feels very heavy. In that case also, there are a very high chance that you have got Meniere's disease. You will have a constant tinnitus which will not resolve on its own very soon. It will take a long time, lot of effort for you, and sometime will also impact your quality of life when you will have a Meniere's disease. There could be a hearing loss that you can experience if you have got Meniere's disease. So, if these 4 symptoms are present in you, vertigo, hearing loss, constant sensation of fullness in the ear, tinnitus and lack of balance, then you should see an ENT doctor as soon as possible, get yourself diagnosed and start treating your Meniere's disease. Now, how or what doctor will do in order to conclude the diagnosis of Meniere's disease? So, the number one ruling out factor for a doctor would be your clinical history. If you will have a history of diabetes mellitus, hypertension, if you will have history of a very strong viral infection inside your ear, if you will have history of any autoimmune disorder, or if you will have a family history of vestibular disorder, then doctor might consider Meniere's disease as a leading cause for your problem. But that's not all. Doctor will also perform some physical test for you in order to do a differential diagnosis from BPPV, which is called as benign paroxysmal positional vertigo, which might look very similar to Meniere's disease. But at that time, it's a pure vertigo that's happening due to the positional changes and not due to a fluid buildup. Doctor will also suggest you some blood test, at the same time some scans like CT scan, MRI and hearing test in order to rule out some other condition which could lead to a similar symptoms. So, it's important whenever you are having any sort of balance disorder, get yourself diagnosed, because your right diagnosis will change the course of your treatment, at the same time will also change the course of your prognosis or else recovery. Now let's talk about the treatment side of it. Meniere's disease require a very strong multidisciplinary approach. It's not just the physiotherapist who is going to help you, it's not just the ENT doctor who is going to help you, it's not just the audiologist who is going to help you. You might need to work with a lot of professionals in order to work on your Meniere's disease. So the number one treatment that Meniere's disease require is medication. Doctor will suggest you certain medication in order to reduce the fluid buildup that is happening inside your ear. Doctor will recommend you to restrict your salt intake because salt will increase the fluid buildup inside your body. So you might have to bring up some dietary modification and you have to go on a low sodium diet. Chocolate and caffeine have to be figured out as the triggers for vertigo attacks, at the same time tinnitus. Hence, you might have to limit your caffeine and chocolate intake if you have got Meniere's disease. You might have to go through a cognitive therapy in order to work on your symptoms like stress, anxiety, depression that will develop over a period of time due to this constant sense of falling down, losing balance and tremors that eventually can develop as a complication. Next, last but not the least, will be your vestibular rehabilitation exercises. This will play a very important role to work on your vertigo symptom control. Different maneuvers, different exercises exist in order to bring the vertigo symptoms under control, and that is antibiotic treatment for ear infection. Now definitely whenever there is a fluid buildup that is happening inside the ear, the chances of developing further infection are very high, and that's where doctor might recommend you antibiotics in order to bring these symptoms of infection under control. Pressure pulse treatment is also something that is very effective and impactful in Meniere's disease, and this air pressure improves the movement of the fluid and helps or works on the endolymph fluid, which is causing the symptoms of vertigo and tinnitus inside your ear. It is used in severe scenarios. And last treatment, but it is used the least, and that is the option of surgery. Meniere's disease, when treated in a conservative manner but does not show result, in that time your doctor might consider doing a surgical procedure. In this procedure, they might extract the excess fluid that is being built up inside the ear in order to reduce that pressure and reduce the symptoms. The second method that they can use in order to give a surgical intervention to your Meniere's disease is cutting of your vestibular nerve. Yes, vestibular nerve is a nerve that's constantly carrying the sensation from your vestibular organ to your brain and vice versa. So there is a motor branch and there is a sensory branch. If there is an excess sensitivity that's coming, in that case doctor might consider doing a surgical procedure where they decompress or cut the nerve to an extent in order to reduce that sensitivity. But again, as I mentioned, this is the last resort that doctor will consider only in the cases where all the medical management have not worked. So Meniere's disease can definitely turn serious if not treated at right time, and can lead to some serious accidents like fall, injuries, etc. Hence, it's very important that it is identified sooner and treated as soon as possible. You might have to work with many other professionals in order to get an optimal result, but please don't ignore this problem as it can impact your quality of life in a really bad manner. I hope you found this video helpful. In upcoming videos, I will share a lot of further information around vestibular disorder. I would love to hear from you. What are you feeling and what are your challenges with your balance system? If you do have any request on any of the topics that we should make our video on, feel free to put your suggestions in the comment section below. I would also like to invite you to our free community where we raise a lot of awareness on different health conditions and give you a lot of tips and conduct regular educational sessions that can improve your quality of life. If you want to be part of this community, the link is mentioned in the description. Feel free to click on it and join this community. It's absolutely free for you to join and start working on your health today. Thank you.